Would you be concerned if your presidential candidate of choice was diagnosed 3.5 years ago with a disease that has a 3 to 5 year life expectancy? This is Hillary Clinton's exact situation based on medical records that were leaked, indicating that Hillary is suffering from a disease called vascular dementia. Some people have laid claim that the leaked health record exposing Hillary's dementia and seizures is a fake. However, I want to point out that this could be a real document, stolen from Hillary Clinton's chart. To begin, the Clinton campaign tried to debunk the record based on the fact that it doesn't have a letterhead from the doctor. But if you've worked in healthcare, you'll know that most of the pages of the healthcare record kept at the doctor's office don't actually have letterhead on them. Letterhead is mostly used when a document is being mailed to a patient. You can also see that there is no recipient address on the document. Instead, there is an address from the doctor's office, which indicates that this is a page directly from Hillary Clinton's chart kept at the office. Every page in a patient's chart must contain patient identifiers including name, date of birth, and account number. Social Security might also be included. If these are not included on even one single page of a patient's health record, an auditing agency can penalize an infracting institution. You can see Hillary's date of birth, name, and account number are included, as is her Social Security number. This is a part of the chart called the doctor's notes. This is almost never shared with the patient unless the patient's request to see it. A doctor's note usually has 5 to 6 parts, including a present complaint, a history, an examination, a diagnosis, an impression, and a plan. Sometimes the impression and plan are combined together, as in the case of this note. This is from Hillary's chart, kept at Mount Kisco Medical Group. It appears somebody took a photograph of the entry of this doctor's note and leaked it to the public. It has no letterhead because it was never meant to be mailed. Hillary Clinton is running a campaign for president, knowing that she will die. Patients who are diagnosed with vascular dementia are given approximately a 3 to 5 year life expectancy. However, it is likely that their quality of life during this time period will greatly decline over that 3 to 5 years. We can see Hillary demonstrating problems even now with motor movement, with verbal communication, with forgetfulness, and with weakness. Subcortical vascular dementia is an especially difficult form of the disease because it affects the brainstem, which controls many of the primitive functions of our bodies, functions such as breathing, heart rate, and regulation of blood pressure. As scientists, we are still trying to understand Hillary's disease, how to treat it, and what causes it. We have evidence that subcortical vascular dementia involves a disruption of blood flow to the subcortex region of the brain. Because there is no blood, the white matter in the brain begins to die. Small portions of the brain tissue is irreversibly damaged. Vascular dementia can be precipitated by a stroke, multiple strokes, or a blood clot to the head. This is Hillary Clinton's situation in 2012 when she fell and hit her head, causing a large clot to form. I have treated many patients with brain anomalies throughout my career. These include benign and malignant tumors, hemorrhagic and ischemic strokes, neurodegenerative conditions, and autoimmune diseases. I can tell you that Hillary is showing decline consistent with a progressive disease like vascular dementia. I believe so few doctors are speaking out about this now because they don't want to get involved. Remember that the Clinton campaign just vowed to destroy Breitbart because they dared to publish the truth about Hillary Clinton's health. A lot of doctors are scared that they will be targeted by the Clinton campaign as well for speaking out about the truth.
You can see, and by the way, there are two other things that gravely concerned us. When she hit her head, she had to wear these prism glasses when she came out. That is brain damage, and it's affecting her balance.
Hillary Clinton is sick and likely dying. I am not making this up or overstating this. This is typical of the progression of vascular dementia, similar to the progression that we see in Alzheimer's. According to the 2015 checkup, Hillary has developed vascular dementia and the onset of seizures after her 2012 fall and blood clot to her head, which left her in recovery for an astounding 6 months. To say that nothing is wrong with Hillary is not only dishonest, it's actually offensive. Yet media outlets like the New York Times, the Washington Post, the Huffington Post, and NBC continue a relentless campaign to hide the truth from the public. Her cognition and mentation are noticeably affected.
We need to make what we've got work really well and improve it and get the costs out of an upward spiral
Now, her campaign has removed her from almost all campaign appearances, and they have substituted Tim Kaine in where she was supposed to be featured. You can see her schedule has been greatly trimmed. Hillary will make no major appearances, no major speeches on public policy, and give no major media interviews. When she does make a campaign stop for the cameras, the Clinton campaign is creating an illusion that her events are much larger than what they are. For example, a recent leaked video shows that the Clinton campaign staged a fake crowd so that Hillary wouldn't be overwhelmed with the stress of a larger one. Too much stimuli can incite the seizures that we all saw her have on camera. And seizing can lead to oxygen deficiency in the brain, causing further damage and an acceleration of the course of vascular dementia. Seizing must be controlled, and they are doing that using a diazepam autoinjector to stop her seizure before it becomes a spectacle. Loud noises and other noxious stimuli can, on occasion, trigger seizing events. We saw the truth when Hillary was put in front of a crowd of reporters, something that rarely happens these days. She did not react well to it. You can see that she begins her jerky head movements, which many of her supporters tried to claim was her being funny. However, this isn't funny at all. It is offensive to say this when she clearly had a complex partial seizure on camera. This is consistent with the 2015 leaked health record that indicates Hillary is having seizures. During my work, I have witnessed many people having active seizing episodes. People with complex partial types usually have something go wrong, called an automatism. For example, they might smack their lips or shake their head repetitively without knowing it. There's virtually no post-ictal or recovery period following this event, meaning somebody can snap right out of it and appear normal. Clearly, Hillary was not in control of her head jerks, though she did recover quickly from them. This is a complex partial seizure. It is worth noting, by comparison, that patients diagnosed with vascular dementia have a shorter life expectancy than patients who are diagnosed with Alzheimer's. On average, people with vascular dementia live 3 to 5 years, and Hillary was diagnosed with the disease in 2013. This means that Hillary is running for president with the knowledge that she will die very soon. Would you ever elect a president who has advanced Alzheimer's and will likely die even with treatment? If not, then you certainly wouldn't vote for somebody with vascular dementia, which has an even shorter lifespan. Why on earth is Hillary Clinton running for president when she knows that very soon she will be cognitively unable to fulfill the office and requirements of the presidency? Why is Hillary trying to be elected to the most powerful position in the world when she knows that she only has 1.5 years left maximum to live? There are a lot of things to consider now, aren't there? Why did she put the nation in this predicament? If Hillary is able to pull off the unthinkable, and that is to hide her illness until Election Day, we might have an extraordinary situation happen. Remember, vascular dementia is progressive. Hillary could decline very quickly if she's elected, but declines over the course of 2 months to the inauguration day. A decision would have to be made by Obama.
Will Hillary Clinton be perceived as serving Barack Obama's third term?
Plan, and she will be a third term of Obama.
She does represent effectively
a third Obama term.
You know, she has to run for Obama's third term anyway. She can't run away from it, so I think she said, okay, I might as well own it.
Right, it is completely different, and in large part because Hillary Clinton is running to effectively be the third term of Barack Obama.
That's right.